I'm a mid-level practitioner, and I've been with Dr. Peel for about 3 years now, since I've gotten out of school. And it's a lot of fun, and it's enjoyable. I have special training in surgery as a mid-level practitioner and in sports medicine. So I have a master's degree as an athletic trainer, and an athletic trainer being sports medicine based, and special training in surgery like I just said. So
a surgical tech is a part of the operative team. I work hands-on with the doctor. I pass instruments to the doctor. I assist with surgical procedures.
Circulating duties is I assist with the preparing for the case for the surgery. Necessary equipment, making sure the surgeons have everything we need, making sure the surgical technologists have everything they need for the case. Assessing the patient preoperatively, trying to anticipate any special needs there may be.
During anesthesia, I stay with the patient, monitoring their vital signs, their I and O's, and making sure that everything is fine with the patient during the time that they're in the OR for anesthesia.
I think my most important role is acting as a patient advocate. When they're anesthetized or even sedated, they can't speak for themselves. So the circulating nurse in the room does that, kind of watches over things and makes decisions sometimes that would affect the care of the patient.
Well, Erica will be passing the instruments, and Brian's going to be directly assisting Dr. Peel. I'm going to be trying to hold back the skin and whatnot out of the way, and holding the knee up to keep it stable.
The role of the anesthesiologist is to evaluate the patient pre-op. We get standard labs, we get extra labs depending on the medical history, and those are available to the surgeons, and we have nurses that follow our protocols. We then evaluate them the day of the surgery, make sure that they haven't eaten, taken the medicines that are appropriate, and then we go ahead and perform regional or general anesthesia. In this particular case, we're going to do regional anesthesia.
During this procedure, you will see me open up sterile packets. I will set up a back table that has instruments, preferably Dr. Peel's special instruments, and I will be passing them to him.
So we do things such as suturing. We'll do a lot of the closure for Dr. Peel, which you'll see this morning. And again, seeing follow-ups and interpreting x-rays, and then if you see concerning signs and symptoms or concerning issues, you have the physician back to follow back up on.
I like the fact that you get to talk to the patient and follow them all the way through from the time they come into the hospital until they're ready to be discharged to the outpatient area before going home. I like the fact that you monitor the patient constantly. You are in charge of their pressure points while they're sleeping to make sure that everything is going well with them.
During the surgery, you have to be kind of multitask because you're doing a bunch of things at one time, but you also want to do what's best for the patient, but you want to be aware that you don't cause any contamination to anything. So you interact with your other teammates, and you also interact with the doctors.
It's very clean. It's not one of those messy jobs that you see everybody else doing. I'm not worried about coming home all muddy and stuff.
During the surgery, we monitor the anesthetic. We monitor whether they're under general or regional. We're using regional, and we'll monitor the blood pressures and heart rate the whole time, and we'll sedate the patient with propofol or Versed or a combination thereof, and keep them calm so they won't hear anything, because that's a big concern. Patients don't want to hear anything.
I've been in nursing for 16 years. I've been in medicine for 21 years. I was in air rescue and recovery in the Air Force, and kind of got sidetracked into nursing. Started nursing school while I was in the Air Force, and finished 16 years ago.
I did my orthopedic training at Sumter in clinicals, and I just kind of fell in love with it, working there and doing the clinicals. And then we came here and we did a rotation through all of the different areas, and this was my favorite.
My plans are, I'm currently going to nursing school, and I'm going to be a nurse in a couple of years, but right now I enjoy being a surgical tech. Of course, I've been doing it for 5 years, so I mean, I have to enjoy it.
It's also a challenge. It's a challenge as far as, practicing medicine is a challenge, and it's something that every day you wake up and you see something different, and you're doing something different, and it's not like you're just pushing a button every day for a job. So that's kind of what I like about it.
I like the challenge of the cases that we do. A lot of people say the orthopedics, it's really repetitive because we're always doing, total knee is a total knee, or, a fractured wrist, but it's not really, because every case is different. You're going to have different needs arise on each case, so it's challenging. And I think it's also rewarding to meet the patients and be a part of something that's helping them and transitioning them from a period when they're really anxious out in the preoperative area to comforting them and getting them through this. A lot of people we see out in the mall or something, they come up and say, oh, you know, you helped me with my surgery, or you helped do my son's surgery or something, and that's kind of rewarding.
There's times you're like, how much longer can I do this, because it's extremely stressful. Every single day you go to work, you know, something bad can happen. It's not a normal job where nothing happens to anybody. So it's this very stressful job because we're in the operating room every day. We don't do just orthopedics. We don't do just total knees. We do everything. We do little 2-pound babies. We do 100-year-olds. We do everything, and we do all sorts of surgeries. And so it's extremely stressful, and you have to enjoy it.
My most rewarding thing is I always loved surgery, but now I get both the medicine side of it and the surgical side. I get to do my medicine side being an anesthetist, and I get to watch good surgery, and I like that.
First of all, I do a lot of orthopedics, and I think a total knee arthroplasty is probably my favorite kind of surgery to do. Doing orthopedics, I don't very often have to deal with people who have cancer or some kind of a terminal disease. They're always looking forward to their surgery. They're so excited. They're going to get a new knee and they can walk around again. They can even dance again if they want to. So I enjoy that part of it, going out there, talking to the patient, and they're so excited about getting this surgery done.